all the delegates and dignitaries to please be seated. Now we have come to the last and final technical session of today's Ayush Conclave. Welcome to the session on research, quality assurance and use of IT platform in augmenting public health care through Ayush, through National Health Authority, NABH, Research Councils and Ayush Grade. So this session is sort of culmination of all the deliberations where we will be discussing about what are the enablers to achieve the plan which is in place, which is already happening at the ground, and how we can augment it and leverage the technology for the benefit of this particular wonderful mission, which is empowering the grassroots level people and taking care of the wellness, not just illness, it's going beyond that, it is taking care of the wellness of our Indian population. So I would like to take the privilege to invite Dr. Atul Mohan Kochar, CEO NABH, to please come on to the dais, sir. Sir, please. I would like to request Dr. Basant Garg, Additional CEO, National Health Authority, to please come on to the dais. Sir, please. I would like to request Vaidya Rabinarayan Acharya, sir, Director General, CCRAS, to please come on to the dais. Sir, please. I would like to request Dr. Subhash Kaushik, sir, Director General, CCRH, to please come on to the dais. So we are already, pretty much little delayed schedule. So we have very diligent speakers here, and the topic is straightforward, unlike other sessions. So we'll straight away start the presentations. So I would like to request Dr. Atul Mohan, sir, to please present the quality aspects of healthcare in general and NABH in particular. Sir, please. You can change the slides with this. If it's not happening, we can do it.
Sure. Good afternoon to all of you. Thank you so much to the entire team of Ministry of Ayush. Grateful thanks to our Secretary Sir Valedictory Rajesh Kotecha for giving NABH this opportunity to be a small part of this wonderful program. So thank you so much. My topic today is quality assurance in augmenting public health care through Ayush. So Ayush has always been the traditional strength of a country like India. It's a 4,000-year-old pathy. We need no introduction. Worldwide, we have seen the highs of this wonderful system. But in the current domain, what more can we add to strengthen, and what more can be done to create an evidence-based focused mechanism which is leading to patient safety and answers all the queries of healthcare quality also. That is the mission. Okay. So I am representing NABH, the National Accreditation Board for Hospitals and Healthcare Providers. We are one of the boards under Quality Council of India. Quality Council of India is a very young body, not more than 26-year-old. It was formed in 97 by Government of India, coming together with all the leading industry associations like FICCI, ASSOCHAM and CII to create this body. It nests under Ministry of Commerce, DPIIT, Department for Promotion of Industry and Internal Trade. So that is the basic thing. The QCI, the Quality Council of India, was created with a single line mission of creating an ecosystem for quality. It was largely to take care of all the international trade and tariff and other things because of international equivalence which are required. NABH was formed in 2005. We draft and assess against our own standards. So these standards were formed because there were lots of hue and cry because India did not have its own healthcare quality standards. So since then, every 3 years, we have been drafting standards, and Ayush standards are a jewel in the NABH crown. So that is the very brief introduction. That is the mandate which I took you through. QCI has a mandate to take care of quality in all domains. So we have, for example, a board. We have 5 boards. One of the board is NABL. One of the boards is NEBET, the National Board for Education and Training. There is a certification body board, and there is a quality promotion board. So all these 5 boards and a whole lot of divisions. First chairman of Quality Council of India was Shri Ratan Tata ji, and then following that Srinivas Velu, and equally illustrious people have handled this Quality Council of India. And one of the equally important are our chairpersons who head the individual boards also. That is just to highlight that what a credible organization QCI over a short time has emerged to be. So very briefly, I'll take this opportunity to introduce NABH. The role of NABH is to draft standards for healthcare quality and patient safety. So every standard, whatever domain we operate in, revolves around taking care of patient safety in a transparent manner and healthcare quality in a very objective manner. So these are the mission and the vision. These are the values. So over the past 18 years, we strive to do everything to adhere to these 4 values: credibility, responsiveness, transparency, and innovation. And in the recent time, we have added integrity also to that. And everything which we do, we work on a completely paperless mode for the past 4 years. We have put everything on our portals. All our standards are free of charge, downloadable in PDF format. And every which we do is to create a quality. So these are the international linkages. We ourselves are accredited by an umbrella body called ISQA. And this ISQA is a group of about 90 countries which comes together to draft standards. So every 4 years we open our books, everything our working, and ISQA accredits not only our standards, but as an organization also, we hold a place of pride at an international level. We also are an active board member of ASQA, the National Society for Quality Assurance. We have presence in 8 countries. So we also run a program called NABH International. So all SAARC countries, all as far as Philippines also. Then we also have presence in Muscat, UAE, and lots of interest from emerging nations like Uzbekistan, Tajikistan, etc. So these are our certificates. Since long, I mean for past nearly 15 years, out of the 18, we have been active members of ISQA and ASQA. These are the core activities of NABH. We do not only accreditation, we do certification, we do lots of free trainings. So we have a portal, so whether someone is keen to be a part of NABH or not be a part of NABH, they can still log on to the website, and there are a whole lot of resources available. Like what is Code Blue? There are lots of videos, lots of PDFs, lots of newsletters, which contain genuine quality related, patient safety related material free of charge. So please, I will urge everyone to log on to our website, www.nabh.co, and learn from the takeaways. So there's a lot of learning there shared by the experts in the field. This is a footprint which shows today we touch about 17,500 hospitals under 25 program. So since 2005, starting from that one program of hospital accreditation, we have diversified into 25 active running programs. And Ayush, like I mentioned, is the only program, standardized accreditation program in the world at NABH. We also in 2019 developed the entry-level Ayush program to handhold and motivate small and very small Ayush hospitals and centers on the journey of quality. We operate under 3 broad headings of accreditation, certification, and empanelment. So empanelment we do on behalf of Ministry of Health and Family Welfare for CGHS assessments and Ministry of Defense for ECHS assessments. Lots of trainings we do. These are certificate courses, very popular, very low cost, and in the current scenario, we do lots of virtual things also. So these are the certification programs. Please visit our website because time here is short, but you will have lots of learnings and opportunities to be an active part. We are a very inclusive board, and we motivate and invite all of you to be our assessors and trainers also. For the G20, we are the sole partner with Government of India, Ministry of Health and Family Welfare to populate the healinindia.org portal, and the entire medical value travel facilitator program. We are the only accredited partner of Ministry, running since 2018. So lots of trainings under Equality Connect initiatives. Please make use of those trainings. All our standards are freely downloadable in PDF format. If you need printed copies, they are available at a very nominal cost basis. So these are the objectives. So what is NABH? NABH is not paperwork. There are lots of myths related to NABH. NABH does not require expensive consultants. It is essentially a way of life. It is a focused approach to how we conduct our daily lives in a healthcare facility. So that is what it is, from a person-centric approach to a process-centric approach. So please make use of that. This approach, we have been extremely fortunate to have got the guidance of Ministry of Ayush. Our Secretary Sir, our senior functionaries, Shri Dev Pujari ji is here, Dr. Khurana is there, all senior, Dr. Bhadwaj are there. So what they do, Madam is there, Dr. Kavita Madam. So they guide us, and based on the expertise and the guidance, Dr. Manchanda sir, sorry. So all of them, they have drafted the standards. So these standards have been drafted by the technical experts from the ministry, from the industry, and this is the patient approach, how we approach a patient. Each standard is divided into 10 chapters. First 5 chapters are patient-centric. From entry of a patient to discharge and follow-ups is taken care in a right manner by the first 5. The next 5 chapters tell us how the facility should it be, what the management should respond to in certain scenarios. So management-centric, and then there are key performance indicators. What a outcome can be managed. So in a hospital accreditation program, for example, we monitor about 72 outcomes. And based on these outcomes, now the time is right with active cooperation from NHA and the entire ABDM framework. I'm sure in the future we can predict the analysis. For example, if certain areas of the country show dengue, then the policymakers can take note and immediately the trends can be mobilized. That kind of power with the technology integration and the standards is possible in the coming few years. So NABH is creating a culture of patient safety. That is no doubt. Over the past 18 years, 17,000 hospitals have already onboarded, and 12,500 HWCs are to be finished, and that's a commitment we have, and that with the guidance of Ministry of Ayush. So these are the NABH Ayush programs. Under 2009, we drafted our first standard, and under all domains. AYUSH, we have standards for Ayurveda, we have for Yoga and Naturopathy, we have for Unani, and we also have for Homeopathy, and also for Siddha. And in 2019, we came up with the entry-level Ayush standard, which is a very simple integrated approach. And 5 days back, we had the first meeting for a revised integrated accreditation standard under the chairmanship of Madam Dr. Tanuja Nesri Madam, so at the AIA. So now we are closely working together to give a very simplistic, focused approach formula, so that even this traditional wisdom can be projected as an evidence-based mechanism which is recognized worldwide. So these are the Ayush programs, and we are committed to deliver that quality assessment and checks for the 12,500, inclusive of capacity building at a national level. The portal is very simple. I believe yesterday's session was very well attended, and our team took us through, to all of you, through the very simple approach. And we are extremely, extremely thankful to Secretary Sir, Ministry of Ayush total, and the total team, which has time and again given us this opportunity to be a small part of the nation building. Thank you so much.
Now I would like to request Dr. Basant Garg, Additional CEO, National Health Authority, to give sir's perspective and in the context of NAM. Sir, please.
Good afternoon, friends. At the very outset, I would like to thank Ministry of Ayush for having us here and for giving me this opportunity to come and sensitize you about the Ayushman Bharat Digital Mission. The mission, which was launched by Honorable Prime Minister in September 2021, aims to achieve setting up of a digital health ecosystem in the country. So, which brings us to the vision of the mission is to create a national digital health ecosystem that supports universal health coverage through provision of a wide range of data, information and infrastructure services, leveraging upon open, interoperable, standard-based digital systems and ensuring security, confidentiality and privacy of health-related personal information. So what does this mean? It means that the data of the patient stays where it is today. In hospitals, in laboratories, even today, health-related data is stored digitally, but the patient has no access to it. He is provided with a physical PDF or a printed document which he keeps and preserves for life. Whenever he has to go to seek appointment, to seek consultation with another doctor, he is expected to carry that physical copy of his past health record, his prescription, his discharge summary, or a laboratory report, and he is expected to show it to the doctor. Many a times the patient would not have this record, and then he is subjected to maybe a repetition of the test. This brings in a lot of inefficiency and also affects clinical decision making. Now what ABDM aims to achieve is to bring all this record, to bring all this record to the personal device of the patient, making the patient the master of his health records. And how this is achieved, so we'll talk about it. I don't know, it's happening by itself. So, yeah. So, we have the federated data architecture where the records stay where they are today. Government has no access and government does not bring any health records of the citizens to a central server. We are using the open APIs. The citizen remains in control of the health records and it is only shared with his consent and it is purely voluntary. I'll not go too much into the detail of the ABDM architecture, but what we are actually trying to achieve here is creating the digital highways. It is the government's mandate to create the digital highways wherein private and government entities can come and build up services. Just as in the past we have created physical highways where citizens can use their own vehicles, they can have their own services. So with these digital highways, we aim to create registries which are of trusted and verifiable people. So the first registry is the Ayushman Bharat Health Account. Every citizen of India, all 140 crore Indians will have a unique health ID, the Ayushman Bharat Health Account, which will uniquely identify the patient and will help to link his health records to that health ID. There would be a healthcare professional registry for all doctors, nurses, and all other Indian system of medicine and all other healthcare professionals also. Similarly, there will be a healthcare facility registry, and what this will achieve is that all the players in the health ecosystem, they are uniquely identifiable and they are trusted and verifiable. How this will bring efficiency in the system? So we are trying to achieve this by having these three gateways. The unified health interface will allow exchange of health data from health information provider to health information user. From one doctor to another, from a laboratory to a doctor, with the consent of the patient. The unified health interface will allow discoverability of services, availing of teleconsultations, and the health claims exchange would allow settlement of health insurance claims real time. So how this happens? So we are having this ABDM core registries, the Ayushman Bharat Health Account ABHA, which is a unique, verified and trusted patient demographic details. It is a 14-digit number which is based on your Aadhaar. So Aadhaar has many limitations because it is not shareable, it is not storable as per the policies laid down over the years. Whereas this ABHA, which is built on an identity, Aadhaar entity, can be shared freely and stored also in the various systems. ABHA would be used to link health records, and the patient would be able to visualize his health records, to see his health records on a personal health record application. And this sharing of records will be real time and through patient's consent. Similarly, HPR and HFR, the Healthcare Professional Registry and the Healthcare Facilities Registry, they would allow sharing of documents in standards compliant with FHIR R4 resource format. Integration with the HFR provides access to a centralized repository containing all critical information about the facility, and this is all verified on ground by assessors. So this is a visualization of what the HIECM, the Health Information Exchange, would do. We have the 3 registries which will help us to uniquely identify all the players, the stakeholders in the ecosystem, and health information will flow from the provider to the user in FHIR format with the consent of the patient. This would enable a lot of exchange of health data which is not happening today, and this will enrich decision making. Let me talk about the unified health interface. What UPI has been able to achieve in the financial world, we feel the UHI will enable in the health ecosystem. Today, a patient can only avail services from a doctor if both are present on the same application, on the same platform. Moving away from this platform-centric approach, if we go to the network-centric approach, wherein a patient on one platform can teleconsult with a doctor on a totally different platform. So the patient could be on a private handheld application, whereas a doctor could be on a government setup sitting on eSanjeevani, and both could interact. Right? That is the kind of visibility of discoverability of services which UHI will introduce. And UHI will allow what kind of services? It will allow a booking of consultations, availing teleconsultations. It will allow blood bank facilities, ambulatory facilities. So all these facilities, services that UHI will enable. It will reduce the difficulty of availing services, and it will also help in transparent pricing. And the biggest impact it will have is it will move patients towards preventive health care, because the health-seeking behavior will also improve by bringing down the barriers in availing health services. So where are we today? Out of 140 crore Indians, we have close to 40 crore ABHA numbers. So 40 crore people have their ABHA accounts. More than 2 lakh health facilities are registered. 1.84 lakh plus health professionals have registered, I think, but these numbers are pretty low, the healthcare professional numbers. So we are trying to reach out to more and more doctors, nurses, and practitioners of Indian system of medicine. More than 27 crore health records are linked even today, and people are using the scan and share facility, which I'll talk about later. So every day, close to 50,000 patients use the faster OPD registration facility, which is built on this. So where are we when we talk about Ayush? I think delivering traditional medicine via digital means, it means improving access to Indian system of medicine. That is one way of looking at it. And then in the continuum of care, it also means that we will be able to integrate with the modern system of medicine. And all doctors are able to see the record of the patient, the health record of the patient, not only of allopathic stream, but also if the patient has availed any treatments, any therapies under Indian system of medicine. So for the whole patient journey, the longitudinal health record, it will not only include allopathic record, it will include all kind of health records. And of course, we bring interoperability with ABDM. So all the stakeholders in the ecosystem, in the health ecosystem, they are able to see what has happened. So for government hospitals, public hospitals, for private hospitals, then laboratories, government health programs, the field level workers, digital applications, lockers. So that will integrate and bring interoperability. Now, of course, there are institutions, there are large hospitals, and then there are single doctor clinics. So in this slide, I've tried to explain for small clinics, because I think the world is not just comprised of large institutions, we also have smaller clinics here. So for small clinics and for individual doctors, how do they start their ABDM journey? What you need? You need just a mobile-based HMIS. You don't even, everybody uses a phone, of some kind. Most of us have smartphones. We don't even need a laptop or a computer. A doctor would, or a acharya or a Vaid would only need a mobile-based HMIS, wherein he starts his journey by registering the patient's Abha. If the patient's Abha if patient doesn't have a Abha, his Abha ID will be generated then and there. Otherwise, it will be recalled from the system that the patient already has an Abha. The major complaints, the diagnosis and the treatment would be entered in the HMIS, and this will create the health record. In very simple terms, that's all that is needed. And where to get this HMIS? Already there are players in the market who already have the HMIS. There are private players. The Ministry of Ayush could also come up with an HMIS for an easy to use HMIS for the single doctors, for individual acharyas, and NHA on its end is ready to support development of a Ayush HMIS, provided we do get the standard terminologies for diagnosis, maybe a master data for the kind of treatments that are prescribed. So we can also contribute in developing an Ayush HMIS also, or even a Ayush HMIS component of a normal HMIS. So that can also be developed. Now, from the patient's perspective, let's understand what would a longitudinal health record look like. So this is a case of a lady who interacts with the health system in various ways. Now she may be touched by the reproductive and child health program, by the tuberculosis elimination program. She may visit Ayush hospital, she may visit some other private hospital, or of course COVID immunization or some other kind of immunization. On her own device, on her own mobile or a tab, this is the way a longitudinal health record would look like. So this will give access to the patient to her record. And we have also enabled family folder also. So the one person in the family can have access to health records of the remaining members of the family. So that will enable better management of the health of the family. Let me also say, today all of us, our kids, they study in schools, they come back, every time we have to maybe fill our immunization record. Many of times we don't even find the record because when the kids become older and we have to look up and locate all that record. Let me say, we should all resolve that the next generation should be the generation which has all its health records right from birth, totally digital, totally available to the kids. So that is maybe what we want to move to. So I think I'm very close to my last slide. This is the scan and share facility which I talked about. In most of the public hospitals, all of you must have seen that at the OPD registration counter, there is a long queue of patients. The counter opens at 8, the patients come in at 6. They reserve their place in the queue and they stand and till 12 o'clock also, till the time the OPD counter remains open, OPD registration counter remains open, many a times the patients do not get a chance to register. Now that was a pain point in the patient journey which is addressed, which we have tried to address with scan and share. The patient creates his or her ABHA, and the demographic details of the patient is already there in the ABHA, the name, address, the gender, age, various demographic details are already there in the ABHA. The patient goes there with a QR code based scan and share method. From his personal health record app, the patient is able to share these details to the OPD computer. And he gets a token, he waits for his turn, he goes there and just tells that I want to visit this, I want to consult with this kind of a specialty. This reduces the time which a patient would have otherwise spent in that OPD registration queue we have estimated it reduces from 55 minutes to 4 minutes. That is the kind of saving which has happened here. And this was launched in one single hospital in Delhi, Lady Hardinge Medical College in Delhi, in December, and today more than 700 hospitals across India are using it. More than 50,000 patients daily make use of this facility and they save their time. That is the kind of value, that was an inefficiency in our system, and this has addressed that system. So what ABDM does, it allows us to build all these services which will reduce inefficiency in health. We are now also looking at, this is just one pain point in the patient journey. As we all know, there is another pain point which is when a doctor prescribes a test. You go to a laboratory, they will fill which test is to be done, how much is charged. We come back, pay at the counter, go back and stand in the queue for the laboratory test. So this to and fro of the patient, this again is a pain point. So we are developing another module and another use case for helping a patient scan and share his prescribed tests, making payments then and there. So there's this to and fro journey, standing in queues is not required. And similarly, hospital se bahar nikal ke, with the pharmacist, again we have to stand in a queue for the medicine, and the pharmacist again, the chemist again tells us this is available, this is not available. Again, we are developing a use case with using scan and share only, that we can digitally share our prescription with the chemist, and the chemist is able to package the medicine and deliver it to you there, or you can scan it, order it online, and it is delivered to your home. These are the kind of use cases that we are at NHA, National Health Authority, we are trying to develop to ease the patient journey. And we feel that there is a lot of inefficiency in the way we do our health, in the way we conduct our healthcare business, and that is where the patient's comfort comes in. Let me also share that we were having this discussion with the hospitals about discharge. All of us might have been at some point of time, personally admitted to some hospital or have a relative there. After the successful treatment and everything comes the day of discharge, when we are told that the patient will be discharged at 9 in the morning, and we all know what it means. It only means that maybe by 6 or 7 in the evening, finally the patient gets to go home. So that is another place where we are developing the health claims exchange, which will help in quick processing of claims so that discharge happens quickly. And the hospitals themselves said, if you bring such a thing, it will increase our hospital bed availability by 8%. So without physically increasing any number of hospital beds, we are able to add 8% more hospital beds to the health sector. So that is the kind of efficiencies which ABDM can bring to the system. And we are at NHA, we are ready to collaborate with the Ayush Ministry. We do feel, and let me share, this is my personal conviction, that the Indian system of medicine, the doctors are eager to join the ABDM journey. Compared to the traditional doctors, the allopathic doctors who who have a sunk cost, they have already invested in their systems of, in their existing digital systems, and they are very resistant to move to the digital way of prescribing health. But it is the Indian system of medicine which will probably be the flag bearers of the digital health mission. So with those words, I thank you all for patiently listening to me. Thank you.
Thank you, sir. Now I'd like to call, request Dr. Abhinarayan Acharya, sir, Director General CCRAs, to give the research-based initiatives in public health and also IT initiatives. Sir, please. And my humble request, I think we are...
5 minutes.
Yes, sir, please. Sir. Thank you.
Thank you, Dr. Saket. This one. Presentation. So I am here to share the views as directed by the ministry about the research activities of Ministry of Ayush, and particularly I am going to deal with about the Central Council of Research in Ayurveda, Unani, and Siddha somewhat. Madam is here to tell detail, and homeopathy, Dr. Kaushik is here to tell details about homeopathy. Dear friends, the topic that is research and activities development, for which Ayush is always blamed that we don't have any research, all these things, and we are not convenient to the modern medicine in that aspect. But as regards the research is concerned, Ministry of Ayush, we have 5 research councils, that is Siddha, Ayurveda, Unani, Siddha, Homeopathy, and Naturopathy, Yoga and Naturopathy, and also excluding that, all the National Institute are also doing research on as a part and parcel of their activities. And as regards, this is the headquarters of research councils where at the New Delhi, and as if you go background to the research councils built, it was since 1969, where the different councils are get together, and then they are all are separated now and working according to their vision and mission, which is the major research activities, that is validations of our research product and capacity building, and the research councils are also responsible and also doing for the research outcomes, and this dissemination of the research data is one of the mandate, and they are also disseminating the research publications. You can all log on to the different councils, research paper, research journals. Just like Ayurveda, we have 3 research journals, JDRS, JRAS, and JRM, and homeopathy also, 1 research journal is there, and Unani and Siddha, all the research journals are available. Now this, you can see the footfall of Central Council of Research in Ayurveda. We have 30 units across the country, and out of them, 25 are clinical, for which I have been asked to highlight on the clinical aspects here more. We have the drug research, literary research, other parts, but we have the footfall. Almost all states except Jharkhand and 2 states are there. We have National Institute, Central Research Institute, and Regional Research Institute, and regional centers. And at the same time, Siddha also having 9 research centers, research institute in the mostly in the southern part of the country. And as regards homeopathy is concerned, Dr. Kaushik will tell in detail. There are 27 research institutes across the country. And as regards Unani is concerned, there are 23 research units across the country working in the different parts and different. So if we can, when we include almost all the states are having either Unani, Siddha. This is the footfall of Siddha, Unani, Yoga and Naturopathy councils across the country. And Ayush as a research backdrop, particularly here, you can see the research councils, the mandate, and as a public health, I am exclusively dealing with the presenting here about the public health as a part of NAM. Here we have public outreach activities being funded by Government of India as a scheduled caste sub-plan or scheduled tribe sub-plan, and this is the area where we are working, or scheduled, this is the states where we are working with, there are 22 states are there where we are working. CCRS units is working with public health systems. We are reaching door-to-door service and providing our healthcare facilities at scheduled caste, scheduled tribe, and other subpopulations. And this is particularly for the northeast. This is our position, and particularly the Guwahati, Gangtok, Agartala, and Itanagar, we are providing the healthcare facilities as outreach activities. And this is total activities, outreach activities of the country of scheduled caste, and different from CCRS point of view. At the same, homeopathy, Unani also doing these activities, and also National Institute of Ayurveda, that part. And this is the product. Particularly, we are working with lifestyle disorders, and we are research. There are many research projects as a part of public health activities, and we are eager. If any states come forward for this public health research activities, we will will associate with them to explore the possibilities of validations and validation of the new old product, also new compound formulations will be part of their activities. This is the publications of different publications of CCRS related to public health, we can say, or standardizations, or there are so many, more than 78 publications, but I am concerning with here a few ones. And this is the therapy and modules of yoga. This is the product of, this is the yoga councils which have different monographs and modules for different therapies. And this is one of our lifestyle feasibility of integrity of Ayurveda with allopathy system of medicine, that are part of integrations. We have one tertiary healthcare hospitals to the management of osteoarthritis as a knee. This is one of the major research projects what we have carried out, and this is the outcome being published, and it is available in the public domain. And other activities also. Operational side, we have developed 70 drugs and have safety aspect, because always the Ayush fraternity and particularly Ayush drug is being blamed that we don't have any safety aspect study. I am here to say that almost 30 disease conditions were, and more than 130 formulations has been evaluated, and it is available on the website about the safety aspects. Almost all the classical formulations, and this is integration. So one of the major projects which the Government of India has worked on. Yesterday it was highlighted about the NPCDS programs, and more than 11 lakhs populations were surveyed, and they were taking the benefit. And this what are the output of this major clinical studies has been published in IU and JM like journals. So how to integrate in the public health system along with the modern system of medicines. These articles can be referred, and it can be circulated. And although that we are also working with another strength area of Ayurveda is the maternal child health care, women and child health. We are working with some states, particularly in Maharashtra. Here you can see 30 PSC of Gadchiroli district. We have different research products known as Ayush AG, Ayush AD, Ayush GG. All these products were research open, and if any states come forward with this type of activities, we will be happy to do research, collaborative research along with them. And these are the product of, particularly the Unani have their own product, Siddha also, and homeopathy also research. These are our research products which were in the market available from our councils. And one of the major product is Ayush 64 during that repurposed during COVID time. And another thing, during COVID time also, Ayush has shown its strength, and there are 30 clinical studies carried out across the country that stand alone or with others. COVID-19, I am not going to that in detail. So these are the mobile, we are providing this mobile healthcare services along. These are the contact persons point where any state, we have representatives in every state, and there are contact persons where we can be contacted. And as regards quality is concerned, now according to guidelines, according to the directions of the ministry, almost all our research hospitals are NABH accredited now, and NABL accredited also. Many of our hospitals are NABL accredited, and all our laboratories. I am here to welcome to the drug testing laboratory. As regards the drug testing laboratory is concerned, all our 5 major units are having DTL accredited laboratory, and also NABL accredited. All are NABL accredited. We are here. If any states comes for training purpose, we will be eager to. We have already developed modules for these states. We can give the guidelines and also train them according. And we are also, Minister of Ayush is going to start one Ayush Diksha, one of the training center at going to be established. That there we can start all these programs in future. NABH accredited, CCRS Institute. I am not. As regards another part, I have to also cover the IT part also. This is the Namaste portal. that is National Ayush Morbidity Code. All should attain this. This has been how the hospitals, how many patients. This is the data how the peoples are using this Namaste portal, particularly the morbidity code. Then Dr. Saket will details it in his speech. So this Namaste portal, the morbidity code. Another importance of this portal is that you can see the translation of English equivalent words. Generally, many people refer different technical equivalent terms of classical Ayurveda terms. Here, all the classical Ayurveda, Ayurveda, Siddha, Unani, all the terms has been translated, and the probably English terms has been given in this portal. And this is the portal Ayush Hospitals management system, and you can see this statistics about how this hospital management systems, as Dr. Basant told about this, we have already started this, we are having this in place, and the overall statistics and the today's statistics, if you go, you can see how the people are using this our hospital management system. And this is Ayush Research Portal. What are the updates research, and you can see near about 6,000 some research articles are there, and what are the Ayurveda clinical research is 600 somethings, and among this clinical grade A, grade B, that based upon their quality of research publications also that has been categorized. So this can be publicized, and people other should through NAM and others to take the help of this education systems, and the research management information system is there. We have started, and any complaint about the teachers, that is not for the but the students or teachers for research purpose. And this is another for the Ayurveda, not for you, but this is for Ayurveda. The research Prakriti portal, how to train, how to know about the Prakriti of a person. The portal is available. We are already conducting training. If any states come forward, we'll have training to them in a separate of the physicians of the states also for that purpose. This is another Ayush manuscript. We have a huge number of manuscripts available for that purpose. Anybody interested, they can known as Amar portal. And this is medical libraries, or many our Hyderabad and other laboratories are there. These are the research schemes, and this is also same case for the Unani. Unani has their also own systems to publicize their activities. All these are available. I will share the slides here. So due to shortage of time, I am skipping all the slides. And this point is particularly what the point of discussion here is about our possibilities. If any states come forward as regards the clinical training is concerned, and drug testing and human resources development, all our councils will be happy to be a part of this project. And I thank Kavita Garg madam for providing me the opportunity for here. Thank you all.
Thank you very much, sir. Now I would like to invite Dr. Subhash Kaushik, sir, Director General, CCRH, to present the updates from the homeopathy research. Thank you, sir.
Tell me the time, 5 minutes. 4 minutes, okay. A very good evening to all of you. So under the aegis of Ministry of Ayush, CCRH is undertaking and coordinating, promoting, developing and disseminating the scientific research in homeopathy. Basically, CCRH undertakes research through its various institutes and units across the India, and there are 34 in numbers nowadays. And along with these research studies, we are going through the clinical services and laboratory services, and also IPT services in selected areas. CCRH is basically engaged in multi-dimensional research in different fields like survey and collection of medicinal plant, cultivation of medicinal plant, literary research, drug standardization, drug proving, drug validation, clinical research. So many activities are going on, and we are also upgrading our infrastructure by establishing the state-of-art laboratories, research laboratory, and an in-house BSL2 virology laboratory, etc. Our vision is to promote research that contribute towards the improving the healthcare of the country and contribute to the development and acceptability of homeopathy system, especially in the public health. Our mission statement to conduct scientific and ethical research, thereby promoting safe, gentle, quality assured and effective treatment in healthcare delivery, enhancing success rate of clinical practice and ensuring global acceptance of homeopathy. Basically, we believe in the translational research activities. So in translational research, when we take the scientific discovery made in the lab, in the clinic, or in a hospital setup or out in field, and transform them into new system and approaches to the medical care, which improve the health of the population. So yesterday, Kavita ma'am showed this under NAM, the activities. So we are collaborating these activities under CCRH. These are the contribution to the NAM. Number one, this mother and child health program, then Poshan Abhiyan we have done. This is the NPCDCS program, then Swasth Rakshan program. All the things are available on our sites. So I'm not going in the details. This is the homeopathy for healthy child. And this is the SCSP plans. This is the Azadi Ka Amrit Mahotsav. हमें टारगेट दिया गया था 30 lakhs का out of 75 lakhs. पूरे आयुष को दिया गया था, उसमें से we have done more than 35 lakhs. These are the new initiatives in public health research. हमें कुछ नया काम कर रहे हैं. जहाँ तक हम IT की बात करते हैं तो we are having HCCR portal, AHIMS and Namaste portal. This is our HCCR जहाँ पे हम clinical case repository रख रहे हैं. कोई भी private practitioner भी इसमें contribute कर सकते हैं. This is the AHIMS. और CCRH की जो भूमिका है AHIMS में, हम हमारे जो दो इंस्टीट्यूट्स हैं वो लगातार टॉप 3 इंस्टीट्यूट्स में बने हुए डे 1 से. तो हमने करीब 4,71,167 पेशेंट रजिस्टर्ड किए हैं. आउट ऑफ दैट 4,59,854 कंसल्टेड होते हैं. चूँकि हमारे यहाँ रश बहुत ज़्यादा रहता है तो कुछ पेशेंट रजिस्टर करा के वो कंसल्टेशन नहीं लेते हैं, वो चले जाते हैं बीच में. ये डिफरेंट सिस्टम ऑफ डिजीज़ का है. ये एक SCCR हमने अपना बनाया हुआ है AHMS के अगेंस्ट. ये इनिशिएटिव ऑफ CCRH है. एंड ये एक हमने CHO को ट्रेनिंग दी थी 3-4 जुलाई 2022 में. आप लोगों ने होम्योपैथी वालों ने अटेंड किया होगा. एक ये GCP गुड क्लिनिकल प्रैक्टिस पे जो रेस्पॉन्सिबिलिटी होती है फिर रिसर्चर की, या जो क्लिनिकल ट्रायल पार्टिसिपेशन में जो प्रोटेक्शन होता है, उसके लिए एक हमने GCP गाइडलाइन बनाई है और 300 रुपीज़ में अवेलेबल है. ये कुछ स्टैंडर्ड ट्रीटमेंट गाइडलाइन, जब हम ट्रांसलेशनल रिसर्च की बात करते हैं तो स्टैंडर्ड ट्रीटमेंट गाइडलाइंस हैं और इसमें हमने ये 20 डिजीज़ को कवर किया हुआ है. तो इसमें सारी की सारी डिटेल्स है कि किस बीमारी को लेके क्या डायग्नोसिस कैसे करेंगे, क्या असेसमेंट क्राइटेरिया है, ये सारी चीज़ें. ये भी कुछ पब्लिकेशन से रिलेटेड डिजीज़ मोनोग्राफ हैं. ये कुछ हमारे पब्लिकेशन है. दिस इज़ अवर वेबसाइट. ये CCRH ई-लाइब्रेरी है. ये हमारा होम्योपैथिक ड्रग प्रूविंग है, पेपरलेस हम ड्रग प्रूविंग की तरफ जा रहे हैं. ये कुछ हमने डॉक्यूमेंट्रीज बनाई है और आप हमारी साइट पर जाके देख सकते हैं. ये कुछ अभी लेटेस्ट जो 10 अप्रैल 2023 को हमने लॉन्च किया है. और ये हमारे डिफरेंट सोशल मीडिया ग्रुप्स हैं. नमस्ते, थैंक यू.
Sorry, ma'am, please. I'd like to request Meena Madam, Director, National Institute of Siddha and Director General in charge, CCRS, to provide the perspectives of the teachers.
Good evening, everyone, and thank you for giving me this opportunity to represent Siddha system. And I represent CCRS and NIS. We have, with our CCRS unit, we have 9 peripheral units and headquarters functioning at Chennai. And we have focusing on NCDs and vector-borne diseases and public health issues like anemia, diabetic mellitus, hypertension, heart disease, like that. And our core area of strength, we are focusing on mainly the vector-borne disease and research. And for your information, we have collaborated ICMR NIE for more than 5 years for all our research protocols with their guidelines and support. and we are looking forward to develop our strength areas in research with the state governments also, Tamil Nadu, and we have set a benchmark in dengue treatment at various medical college hospitals in Chennai, and chikungunya treatment, integrated treatment in Chennai hospitals. And we are looking forward to collaborate with the NIRT in the TB eradication program. And we have 5 more public health initiatives in anemia, and we are focusing mainly on our research in anemia, heart disease, cancer, and lifestyle disorders. During COVID, we have initiated more than we have our Siddha doctors working in 40 clinical units set up in the district headquarters with the state government help. And I would like to point out some of our Swasthya Raksha program at our tribal OPD level, outreach programs, and food and lifestyle practices in the school health programs, along with the state government initiatives. And we have some more other clinical focus in research area, and we have published more than 700 papers during the past 10 years. Thank you so much, and I have a very short duration. Thank you, sir. Welcome, sir.
So, thank you all. Before we conclude, I would like to quickly request Kavita madam to give mementos to co-chair sir. Sir, please. I would like to request madam to give memento to Kaushik sir. And I'd like to request Meena madam, please come and receive the memento. Yes. I request Kavita madam to give memento to Meena madam. And thank you all for this last and final session. Thanks for patient hearing. Thank you all. Namaskar. Thank you. And we'll proceed for the next. Yes. Name plates change. Name plates.
Very good evening to Honorable Minister, Secretary Sir, dignitaries and our invitees. I stand before you today filled with immense pride and gratitude as we conclude the two-day National Ayush Mission Conclave. I request Secretary Sir to kindly felicitate our Honorable Minister of State, Ministry of Ayush, Dr. Sarbanand Sonowal. Sorry, Mahendra Bhai Munjapad. I'm sorry. I'm really sorry. I request Dr. Raghu to kindly felicitate Secretary Sir. In the last 2 days, we had 6 sessions. I would like to request Shri Vinay Singh, Director from Himachal Pradesh, to kindly sum up the session of enhancing the efficiency in budget absorption under NAM.
Respected Honorable MOS, Ayush and Women and Child Development, Mahinder Manjupuraji, respected Secretary Ayush, Principal Secretaries, Mission Directors of different states, and all the stakeholders present here. Yesterday, our session started with first topic, enhancing the efficiency in budget absorption under National Ayush Mission. In this session, total there were 5 participants. 3 presentations were from different states and union territories, and 2 presentations were made by ministries. Our first presentation was made by Joint Secretary Policy. If you can zoom it up. First presentation was made by Joint Secretary, National Ayush Mission. He stressed upon better liaising between Ayush Ministry and Health Ministry, because Ayush Ministry is implementing Ayush Wellness Centers, and there is a target of 12,500 Ayush Wellness Centers to be implemented by Ayush Ministry. Like he suggested that in Government of India level, there is a regular meetings and joint sitting between different secretaries, and same kind of meetings should happen at the state level, so that if there is any issue, because in most of the cases we are relying upon the manpower of health department, so if we jointly do the review, then most of the issues can be resolved. Second presentation was made by Jammu and Kashmir. Dr. Mohan Singh, Director Ayush. The main takeaway from his presentation was that he could achieve he could take most of the installments because he was timely on board on PFMS. His state was on board in PFMS in 2021. That helped him opening zero balance accounts of all the DDOs and PIAs. Second, he suggested that in his state there was a central procurement agency, Jammu and Kashmir Medical Supplies Corporation. Through this corporation, they could procure all kind of drugs, equipments and consumables, and by the time they submit the first tranche of procurement to the procurement agency, and by the time utilization comes, they roughly tell them that the second installment of this much with the formalities and as a result, they could send the proposal for next installment to the ministry. They did empanelment of agencies and branding and event management. This helped them for the speedy expenditure under this head, as they had empaneled agencies as and when the installment is received from ministry regarding branding or event management and all these kind of IC activities. The empaneled agencies, they were given straightaway orders, and they were used to book the order expenditure and do the rest of the things. This essentiality of the financial discipline, this timely refund of interest accrued. Whatever interest that used to accrued on the amount which used to be received under SAP, they had submitted it well in time. They did pre-planned consultative meeting 3 months before the start of annual action plan, because the benefit they had is because pre-planned consultative meeting, so they prepared annual action plan well in advance. They had meeting with all the stakeholders and PIAs so that they have a good idea of what are the schemes which could be implemented well in time. Pre-appraisal review meeting, they suggested these are important, as before submission of annual action plan, they used to have pre-appraisal review meetings which help them to monitor the last year's expenditure, so that by reviewing the last year expenditure, they could frame up next annual action plan which is realistic and which is the realistic, so that annual action plan could be implemented in a better way. They had well-manned SPMUs and DPMUs, the state units and DPMUs. They had engaged all kind of consultants, financial, accountancy, as well as the IT related. Second presentation was made by Haryana Additional Director Vandana. The main takeaways from their presentation was timely preparation and submission of SAP. They stressed on timely preparation. It should be made well in time, and fund utilization by prioritizing schemes in SAP. They prioritize the schemes in state annual action plan. They could see which are the schemes which could be implemented in the first tranche. They put those schemes in first installment, and those schemes in which they were, because of some many other reason, they are not able to implement in the first go, then they used to defer those schemes and implement those schemes only which are there to be taken up readily. They stressed on data maintenance in electronic and automation form. This helped them to make state annual action plan more realistic, because data is available readily. Regular monitoring and of funds utilization. They had annual review meetings at the district level also, and they had reporting to the state level as well as to the ministry level also. Through regular monitoring, Haryana from 2014-15 till date, they have 97% of utilization of their fund. So they could achieve only this through regular monitoring. They had regular audit and timely UC submission, because after doing a regular audit and timely UC submission, then only you can claim for the next installment. All in all, the effective planning, prioritizing the projects, simplifying the procedures, use of technology, this helped them to achieve the desired result. Third presentation state was Puducherry. Dr. Sridharan, Director ISM, he stressed that through intelligent planning and continuous monitoring, regular reporting of expenditure, efficiency in budget absorption can be achieved. These were the main takeaways from these presentations. By doing this, we could also achieve more success. Regarding my state in Himachal, a few points I would like to deliver. In Himachal, through these small things, we also achieved some kind of success. We are on PFMS since 2020. We have 740 AWCs to be converted into wellness centers, and by July, 565 will be converted. through this small intervention and with the help of National Ayush Mission, in comparison to last year's OPD of 28 lakhs in Ayush, we rose to 45 lakhs this year. Panchkarma 16,000 last year to we rose to 40,889% this year. This some kind of suggestion from last deliberations, if I may suggest, like in National Health Mission, they approve more budget than the resource pool. Like they approve 125 for 140%. If we also do same thing in National Ayush Mission, then this will help us to do the expenditure, but the expenditure will be limited only to the resource pool, but we can approve more funds. Money should not be compartmentalized, like they suggested that their money is not compartmentalized in National Health Mission. Suppose if you have a 50-bedded hospital and that has a cost of 10 crores and in annual action plan we have 1.5 crore. But if that expenditure could be increased to 8 crores and we are not able to spend in other heads, then we should be allowed to spend more. Suggestion for yoga guides that male and female, they should have same honorarium, because in male they get more and females they get less. So this suggestion came from everybody. I'm thankful to Ministry of Ayush for organizing this well-decorated conclave, and this helped us to share our views with the fellow participants from different states. And we are able to take up the best practices of the different states, and I am hopeful that we all will carry those best practices to our states and deliver the best results. Thank you so much.
Thank you, sir, for your valuable suggestions. Now I invite Dr. Dusu Laji, Deputy Director, Arunachal Pradesh, to sum up a session on orientation on Ayush CHOs on delivery of public health programs.
Thank you. Good afternoon and namaste to all. Honorable Minister of State for Ayush, respected Secretary Ayush, all the senior officers from Department of Ayush, Government of India, all the participants from the districts or states who have come here to attend this 2 days conclave on National Ayush missions. So yesterday we had a good deliberations on the orientations of CHOs. As you all know that for implementations of the Ayush Health and Wellness Center and the Ayush as a whole, training is one of the important component. Unless we train them well, the program may not be implemented or successful as with this thing. Please zoom. We had a good deliberations and participants from Jharkhand and Karnataka. Good deliberations made by the Jharkhand state, Karnataka, and advisor CPC community process, CPCH Balasubramanian sir. I'll just give the few takeaway points what we had discussed yesterday. The community participation, intersectoral coordinations, appropriate technology, and equitable distribution of resource services, and opportunity to promote health and reduce disparities are the principles of health and wellness activities. Then second takeaway point is the integrations of digital tools for effective planning and implementation of comprehensive primary health care by creating longitudinal health records of each impaneled individuals. Community health officers to take leadership roles and actively participate in public health programs for different segments like children, adolescents, health, and geriatric populations. Strengthen the engagement of CHOs and ASA and health and wellness centers functionaries, and further orient them about the strength of Ayush. Implementation of GIS mapping of Ayush facilities to maintain state-wise GIS asset to provide service for governance. some of the states are facing the challenges of high turnover of IUCHO because of some this shortage of manpower and better opportunity in the some state stated that few IUS CHO are left on the mid time. To increase the number of IUS health and wellness centers at the residential facilities, to upgrade all remaining IUS dispensary into health and wellness center, as stated by this Karnataka, and may consider provision of Panchkrama services to develop the Ayush Gram in all places. These are the few points they have suggested on the deliberations of 2 days orientations on CHOs to deliver a public health program. Thank you very much.
Thank you, sir. I now invite Dr. A.L. Singh, Director, Ayush, Manipur, to sum up the session on showcasing the best practices under NAM.
Respected MOS, Mahendra Bhai, Sri Mahendra Bhai Manjupara, Minister of State Ayush, Women and Child Development, Secretary Ayush, Sir Koseta. Sir, next, Madam Joint Secretary Ayush, and all the officers and officials coming from different states of India, and all the invitees and ladies and gentlemen. Showcasing the practice under NAM experiencing from state and union territory. In this session, there are 7 speakers. They have expressed their ideas in different ways. Sri Lina Jori IS, Principal Secretary, Uttar Pradesh, expressed infrastructure and wide Ayush network in the state of Uttar Pradesh. Second speaker was Dayanand P, Secretary Chhattisgarh. He expressed Sian Jatan, promoting the concept of happy and healthy aging by taking care of the growing elderly population in the state. The third speaker expressed that Janani, unique project of NAM Kerala, through government homeopathy hospital with an aim to provide treatment for infertility, and Drishti, comprehensive Ayurvedic approach to prevent blindness, intending treatment among school children and elderly people. Number 3 point was Arogya Nauka, full-fledged mobile clinic on a boat, providing healthcare facilities to the backwater inhabitants. It was delivered by Sri Kesavendra, IAS Special Secretary, Kerala. The fourth speaker was Pankaj Pandey, Secretary, Uttarakhand. Outreach camp, he expressed the need of outreach camp to create awareness and interest toward Ayush service amongst people. The fifth speaker was Bhagat Singh, Mission Director, Rajasthan Express, Anchal Prasuta Center, launched with an objective to reduce maternal and infant mortality rate, and the Geriatric Disease Prevention Center to provide Ayush healthcare service to the elderly people in the state of Rajasthan. Then the sixth speaker was V.D. C.N. Jani, Director, Gujarat. She expressed Ayush government facility infrastructure, building robust infrastructuring at the government facility will promote and develop Ayush system in the state. And the last and not the least, the speaker was Padma Nandan, consultant, Tamil Nadu. And she expressed Mega Feru Sanjeevi kit, launched for pregnant women and ensuring normal delivery while providing a free and postnatal care. And Second point she expressed was total number of 1,40,294 Megaferus Sanjeevi kits were distributed, providing pre and postnatal care throughout the different states. These are the ideas and the best practices expressed by different speakers from different states, and all the states togetherly may refer and take the innovative ideas from these ideas and try to promote and develop IOS. I am very thankful to the Ministry of IOS for giving me a few minutes to deliver a speech and for organizing a very precious and valuable National IOS Mission Conclave in Delhi. Thank you all.
Thank you, sir. I now invite Dr. Ravinder Bawa, Director, Homeopathy Punjab, to sum up the session of Role of Teaching Institutes in Strengthening the Ayush Contribution in Public Health.
Good evening, everyone. A respectable Minister of Ayush, Secretary of Ayush, and all other dignitaries. This NAM Conclave, National Ayush Mission Conclave, has been a great success because we have learned a lot here. It was a platform where all the states were present, and they could share their experiences and we could learn from them. So it has been very, very informative and educative. We have learned a lot, and hence it's really been great being a part of it. Our ministers, the Ministry of Ayush and Ministry of Health, have worked in harmony just for one common goal, that is integrated healthcare. Integrated healthcare is so much important. They have prioritized health to such an extent that Ayush comes into play. They have launched online portals. From a single click on the mobile, we can see the health centers which are near to us, and every sick person has an option to choose and opt for the line of treatment he thinks is best for him. And then there is coming up telemedicines and many other online ways in which we can choose the line of treatment we want. Here, I would just like to sum up in very short. Suppose if a person is sick, when the program was launched on a few years back on mother and child health care, every mother who is pregnant does not want to take medicine because she thinks it will affect the unborn child. It might cause some side effects. And here I would like to say every mother who is pregnant, every mother would love to take homeopathy as she knows it is totally safe for her unborn child. So homeopathy is Ramban in many aspects. When we say skin diseases, it's almost like a synonym to homeopathy. Skin disease, or anybody you ask for, they'll say, go for homeopathy. Kidney stones, kidney diseases, liver diseases, go for homeopathy. So, I being a homeopath, and I'm speaking on behalf of one, I would just like to tell you one more thing, that, okay, sorry. So this is about homeopathy, and Ayurveda has been our ancestral science which has brought to us down from the years. Okay. So in these 2 days, we have learned what the government has done. It has prioritized our education and our health. And we are thankful to the government for prioritizing this, because this is our future. If our health and education system is prioritized, this is our, it was too short time, so we should all take a pledge that we take care of our health.
Let me summarize.
Thank you.
Regarding this session on capacity building, our chairperson from NCISM, NCH, Baswa Reddy ji from MDNFI, and other और कौन-कौन थे इस session में, they all they all expressed that how it is related to public health program. खुराना जी ने बहुत अच्छे से एक्सप्लेन किया कि कैसे हम अपने होम्योपैथी के जो कॉलेजेज हैं और जो इंस्टीट्यूट हैं, उसी तरीके से आयुर्वेदा के लिए NCISM के चेयरपर्सन ने सबको बताया कि यदि स्टेट को किसी भी चीज़ की ज़रूरत है तो आवर एजुकेशनल इंस्टीट्यूट्स आर देयर टू फैसिलिटेट, टू हेल्प एंड हाथ से हाथ मिला करके हम आगे कैसे बढ़ सकते हैं. उसी तरीके से जब योगा के बारे में बासवा जी ने बताया तो उन्होंने हमें 3 मिनट का योगा भी कराया था. योगा एट चेयर जो रिसेंटली लॉन्च हुआ है, जितने भी IT असेट्स हैं योगा के बारे में, वो सारी IT असेट्स हम लोगों ने आपके बारकोड में भी, जो आप ये पहना है इसको फेंकिएगा नहीं, इस बारकोड में सारी नेशनल आयुष मिशन की भी गाइडलाइंस हैं, योगा की भी गाइडलाइंस हैं. इसको आप फ़ोन पर स्कैन करेंगे वो मिलेगी. उसके अलावा उन्होंने बताया, क्योंकि बहुत सारे स्टेट से हमारे पास ये रिक्वेस्ट आ रही थी कि हमारे पास योगा इंस्ट्रक्टर अवेलेबल नहीं है, तो हम क्या करें, किस तरीके से ये योगा का प्रोग्राम करें. तो उन्होंने बताया कि हमारे YCB सर्टिफाइड योगा इंस्ट्रक्टर्स, जो कि जम्मू एंड कश्मीर का मॉडल उन्होंने बताया, कर्नाटका का बताया, लद्दाख का बताया कि किस तरीके से शॉर्ट ड्यूरेशन में थ्रू फिजिकल मोड कुछ ट्रेनिंग्स फिजिकल कराई और कुछ डिजिटल कराई, और सारे स्टेट्स को ऑन बोर्ड लेकर के इस तरीके से आपकी प्रॉब्लम को रिजॉल्व किया जा सकता है. और कौन था इस सेशन में, मैं फॉरगॉट किया. या उसके अलावा संजीव शर्मा जी ने NIA का अपना एक्सपीरियंस बताया था कि किस तरीके से हमारा जो नेशनल इंस्टीट्यूट है आगे बढ़ कर के हर पब्लिक हेल्थ प्रोग्राम्स में हेल्प कर रहा है. देयर वर 3 प्रेजेंटेशंस फ्रॉम स्टेट ऑफ वेस्ट बंगाल, जिन्होंने अपने हर्बल गार्डन के बारे में बताया था, एंड सिक्किम अबाउट देयर सोबा रिक्पा इंस्टीट्यूट, कि किस तरीके से सोबा रिक्पा इंस्टीट्यूट में फैसिलिटी दी जा रही हैं, एंड 1 फ्रॉम आसाम रिगार्डिंग जीव धारा. दैट्स ऑल फॉर दिस सेशन. Thank you.
Thank you, ma'am, for highlighting the key points of the session. Now I request Dr. Manjushri, Assistant Director from Chandigarh, to sum up the session of research quality assurance and use of IT platform in augmenting public health care through Ayush.
Good evening, sir. आदरणीय मंत्री महोदय, सेक्रेटरी सर, JS मैम, आप सबको मेरा अभिनंदन है. मैं इस सेशन में सबसे पहले प्रेजेंटेशन थी NABH एक्सपर्ट की, जिन्होंने NABH के बारे में बताया कि इसका मेन जो मोटिव है दैट इज़ एविडेंस, टू क्रिएट एविडेंस बेस्ड मैकेनिज्म फॉर रिकॉग्निशन वर्ल्ड वाइज. अगर हम क्वालिटी को आयुष सिस्टम्स में इंट्रोड्यूस करते हैं, जैसे कि हेल्थ डिपार्टमेंट ने एनक्वास के थ्रू और NAB के थ्रू क्वालिटी इंट्रोडक्शन की है और उन्हें वर्ल्ड वाइड रिकॉग्निशन मिली है. आयुष में NAB के साथ कोलैबोरेशन से ये क्वालिटी इंट्रोड्यूस करने से हम एक बहुत अच्छे प्लेटफॉर्म पे आयुष को रिकॉग्निशन दिलवा पाएंगे. और इनकी जो इन्होंने एक्सप्लेन किया कि जो इनका NAB का एक्रेडिटेशन है, ये आयुष एंट्री लेवल भी है, आयुष हॉस्पिटल्स के लिए भी है और आयुष एजुकेशनल इंस्टीट्यूशंस के लिए भी है, जिसमें डिफरेंट डाटा पोर्टल, ये पेशेंट सेंट्रिक भी है, मैनेजमेंट सेंट्रिक भी है और की परफॉर्मेंस इंडिकेटर्स, आउटकम इंडिकेटर्स इसमें पूरे डिफाइन किए हैं. दूसरा सेशन ADHM से था, आयुष्मान भारत डिजिटल हेल्थ मिशन, एक बहुत अच्छा इनिशिएटिव. सबसे पहले तो मैं मिनिस्ट्री ऑफ आयुष को बधाई दूंगी कि उन्होंने इतने एक्सपर्ट्स को एक प्लेटफॉर्म पे लेके आए हैं, क्वालिटी वालों को भी, एजुकेशन वालों को भी, रिसर्च काउंसिल्स को भी और स्टेट्स से, UT से आयुष एक्सपर्ट्स को भी. अगर ये सब मिल के एक टीम की तरह आयुष सिस्टम्स को एक कोलैबोरेटिव वे में अपलिफ्ट करते हैं, तो मुझे बिल्कुल डाउट नहीं है कि आयुष सिस्टम्स हमारा जो वो एक पिरामिड का बेस था प्राइमरी केयर का, हम उसका पूरा लोड उठा सकते हैं ताकि सेकेंडरी और टर्शरी केयर पे लोड कम हो जाए. ये हमारे लिए एक बहुत बड़ा मौका है. ये आयुष्मान भारत डिजिटल हेल्थ मिशन में उन्होंने बड़े अच्छे से क्लेम किया कि देयर एम इज़ टू सेट अप डिजिटल हेल्थ वेरियस एप्स and which will facilitate the data generation from allopathic side to Ayush side and from various platforms they are developing, from patient to doctor, patient to pharmacies, patient to laboratories. So these platforms, they will go a lot, they will go in lot way in data generation, and this data will help us in planning various policies for the ministries for welfare of the patients. So this data collection is very useful. Last presentations were from research councils, आयुर्वेदा काउंसिल, होम्योपैथिक काउंसिल और सिद्धा काउंसिल से डायरेक्टर जनरल्स ने अपनी प्रेजेंटेशंस दी। और मेरा एक ही सबसे अनुरोध है कि हम स्टेट्स और यूटीज़ अगर रिसर्च काउंसिल्स के साथ मिलके आयुष पब्लिक हेल्थ प्रोग्राम्स में काम करें तो हम डेफिनेटली एक एविडेंस बेस्ड डेटा जनरेट कर पाएंगे, जिससे हम एक तो अपने आप को रिकॉग्नाइज कर पाएंगे, ग्लोबल लेवल पे हमें रिकॉग्निशन मिलेगी। दूसरा, हम और ऐसे फर्दर स्टेप्स ले पाएंगे जिससे हम पेशेंट्स के वेलफेयर को और एनहांस कर सकें। ये हमारे लिए एक बहुत बड़ा इनिशिएटिव है। थैंक यू, थैंक्स अ लॉट।
Thank you, ma'am. I now invite Shri Vikram Singh, Director, Ministry of Ayush, to sum up the session of leveraging the procurement system and supply chain management.
सबको नमस्कार। सर, ये मैंने सेशन जो है ऑनलाइन देखा था और मैं बधाई देना चाहूँगा कि ऑनलाइन की क्वालिटी यहाँ की क्वालिटी से अच्छी लगी। तो ऑर्गेनाइजेशंस को बहुत बहुत धन्यवाद। सर, इसमें जो है बेसिकली 7 लोगों ने प्रेजेंटेशन किया था, जिसमें टेमकोल के थे डॉक्टर श्रीनी, औषधि के डॉक्टर हार्दिक, होमको के शोभा चंद्रा जी और IMPCL के डॉक्टर मुकेश कुमार, ESI के डॉक्टर प्रभाकर राव और जैम से श्रीमती मंजू शर्मा और आयुष मंत्रालय से हमारे एडवाइज़र कौस्तुभ उपाध्याय जी। सर, बड़ा इंटरेस्टिंग सा ये सेशन था और बड़े अच्छे की पॉइंट्स है इसमें। तो इसमें सबसे पहला जो पॉइंट डिस्कस किया गया कि अवेलेबिलिटी ऑफ मेडिसिन्स आर इक्वली इम्पोर्टेंट एज अवेलेबिलिटी ऑफ डॉक्टर्स। डॉक्टर्स है, मेडिसिन्स नहीं है, तो उसका कोई फ़ायदा नहीं है। तो बहुत अच्छा ये डिस्कस किया और ये हुआ कि भाई रेगुलर सप्लाई भी होनी चाहिए। अभी क्या है कि ऑर्डर दे देते हैं और फिर तुरंत चाहिए तो तुरंत नहीं मिलती, तो सप्लाई टाइम का भी एक इशू आया कि उसके लिए सफिशिएंट टाइम चाहिए, तो 45 से 60 दिन होगा उसका टाइम। उसके बाद प्रोक्योरमेंट की भी होनी चाहिए कि भाई प्रोक्योरमेंट, ये आयुष मेडिसिन जनरली ओपन मार्केट में अवेलेबल नहीं होती है, तो इसको किस तरह से बेटर प्रोक्योरमेंट किया जाए। तो ये डिस्कस हुआ कि भाई एज पर गवर्नमेंट पॉलिसी 25% प्रोक्योरमेंट टू बी डन फ्रॉम MSMEs। तो ये सजेशन आया है कि ऐसा करते हैं कि 25% प्रोक्योरमेंट ईच फ्रॉम CPSU, स्टेट PSUs, MSMEs और जनरल फर्म से भी कर सकते हैं। फिर ये भी होया कि ये डिस्कस किया गया कि भाई जन औषधि केंद्र है 9000 से ज़्यादा, क्या हम इन सप्लाई जो है आयुष मेडिसिन को वहाँ पे सप्लाई दे सकते हैं, सबके पास पहुँच जाएगी। फिर ये भी डिस्कस हुआ जैम के ऊपर, अभी तो IMPCL की है, बहुत दूसरी कंपनियां भी चाह रही थी कि वो जैम पे आ जाए, और जैम का प्रेजेंटेशन भी बहुत अच्छा था, उसमें पूरी प्रोसेस समझाई गई और ये भी हुआ कि जैम के लिए स्पेशल ट्रेनिंग भी दी जाएगी। तो मुझे लग रहा है बहुत ही इफेक्टिव, इंटरेस्टिंग और इन्फॉर्मेटिव ये सेशन रहा था। दिस वॉज द टेक अवेज। थैंक यू वेरी मच सर।
Thank you, sir. I now request Dr. Suniti to kindly felicitate Dr. Vinay Singh, Director, Himachal Pradesh. Sir. Dr. Dusulaji, Deputy Director from Arunachal Pradesh. Dr. A.L. Singh, Director, Manipur. Dr. Ravinder Bawa, Director, Homeopathy, Punjab. Dr. Manjushri, Assistant Director, Chandigarh. Shri Vikram Singh, Director, Ministry of Ayush.
We want two quick comments from the states who have not spoken at all in this forum. Two quick comments. Yeah.
So, good evening to all of you, Honorable Minister, Sir, Secretary, Sir, and all the Joint Secretaries. For the last 2 days, I got opportunity to attend almost all the sessions, right, starting from our inaugural session, and then all the ministers were there, and then all the technical sessions. Sir, I came here with different expectations, actually. I thought I will be there for 1 or 2 hours, and just review will be there. Whether UC has not come, you have not been able to submit your this and that, and your SAP has not. So I came with that mindset. But when I saw the program, I must compliment Ministry of Ayush and all the organizers. It was a very comprehensive program. And after seeing that program, I invited all my team members that we have not yet submitted our SAP. What more needs to be learned? This is the opportunity. And in these 2 days of session, I must confess that we have learned a lot. This is going to help each and every state, those who have attended this. And I think for this program, our ministry needs to be given standing ovations. So I request all my state colleagues to be there, and let us give standing ovations to the ministry program for organizing such a lovely program. It was not routine. So thank you very much. It was not routine just to give record of funds. It was something more than that. Thank you very much.
One more volunteer, please, who have not spoken.
Hello.
Yes.
Hello, ma'am.
हेलो, आई एम डॉक्टर मीनल जोशी, डेप्यूटी डायरेक्टर आयुष गोवा। मैं जब भी कभी आयुष के किसी भी प्रोग्राम में आती हूँ, मैं बहुत सारी एनर्जी लेके जाती हूँ, बहुत सारी अच्छी अच्छी आइडियाज़ लेके जाती हूँ, और मुझे ऐसा लगता है कि ऐसे प्रोग्राम तद्वितीय संभाषा हमेशा होनी चाहिए, क्योंकि हम लोगों को मिलने के लिए अवसर ही नहीं मिलता है। हम अपने अपने कामों में इतने बिजी हो जाते हैं कि हमको और कुछ सोचने के लिए और कुछ नया इनपुट देने के लिए कुछ अच्छा सा अवसर नहीं मिलता है, अच्छा सा प्लेटफॉर्म नहीं मिलता है। तो ऐसे प्लेटफॉर्म की हमें जब ज़रूरत पड़ती है, हमें सिर्फ नाम का नाम याद आता है कि कहीं भी हम हमारा कुछ भी कम्युनिकेशन भेजें, उसके लिए उसके ऊपर सचमुच कुछ विचार मंथन होता है, कुछ एक्शन ली जाती है, कुछ हमको पॉजिटिव, किसी चीज़ पर अगर आप एक्शन नहीं ले रहे हो तो भी हमको आपसे फीडबैक मिलता है कि ये इस तरह नहीं होगा, उस तरह होगा, कब होगा, थोड़ा टाइम लगेगा। तो दैट इज़ वेरी बिग एसेटफुल फीडबैक टू अस कि हमारा कोई सुन रहा है। सो आई एम ऑलवेज हैप्पी टू अटेंड ऑल प्रोग्राम्स फ्रॉम आयुष। अपने नाम को जैसे जगना चाहिए, उसी तरह ये भी प्रोग्राम 100% सक्सेसफुल रहा।
Thank you, ma'am.
Respected dignitaries, good evening. The session was very informative.
Introduce करिए आप अपने आप को introduce करिए.
Sir?
Introduce yourself.
Yeah, my name is Dr. Ranganath. I am consultant from Andhra Pradesh. I am attending since yesterday. The session is very informative and very delightful, seeing all the officials at one stage giving so much inputs to us to how to implement the National Ayush Mission. The individual, every individual who attend this conclave need not to be read the NAM book, the guidelines book. So such an informative thing we are getting this, and the best practices we got from all the states. We will get that inputs and we'll implement in our state also. And the Ayush Gram we are implementing in our state. The outreach activities, everything will be more enhanced by taking all these inputs. And I congratulate everyone who attended this, who took the treasure of this knowledge from our dignitaries. मान्य मंत्री जी, आपको बहुत बहुत नमस्कार सर। आपने हमारा नेशनल आयुष मिशन को बजट अच्छा से दिया है. We'll implement the program in very good manner. Thank you very much. I hope this conclave will be celebrating every year, and this information will be passed on every year. And thank you for giving me this opportunity.
Thank you. I'll request Secretary Sir to say a few words, please.
Honorable Minister of State, Ayush and WCD, Dr. Mahendra Bhai Munspara ji, both the joint secretaries from the dais, Sri Rahul Sharma ji, Srimati Kavita Garg ji, all the leaderships from the Ayush, both the chairmen of National Commission and our directors of National Institutes and the DGs of Research Councils and advisors from Ministry, colleagues from Ministry, the National Ayush Mission team, all leaders participated from across the country. My namaskar and good evening to you all. पहले मैं कुछ बहुत अच्छे इम्प्रेसिव स्टैटिस्टिक्स देना चाहता हूँ. मैं बहुत कम कहूँगा लेकिन बहुत इम्प्रेसिव है सर, जो मुझे टीम ने बताया है कि यहाँ पर ये इस कार्यक्रम में न केवल 12 से ज़्यादा मंत्री लोग पधारे, 2 एडिशनल चीफ सेक्रेटरी आए, प्रिंसिपल सेक्रेटरी लेवल के 6 ऑफिसर्स आए, कमिश्नर एंड डीजी लेवल के 2 ऑफिसर्स आए, मिशन डायरेक्टर एंड स्पेशल सेक्रेटरी लेवल के 9 ऑफिसर्स आए, डायरेक्टर जॉइंट डायरेक्टर लेवल के 35 स्टेट से आए. सिर्फ पूरे देश में एक ही यूटी नहीं आ पाए, उनका भी हमारे पास जानकारी है कि फॉर सम रीज़न दे वर नॉट एबल टू पार्टिसिपेट, दादरा नगर हवेली एंड दीव. बाकी पूरे देश से सभी स्टेट से रिप्रेजेंटेशन आया. और ये बहुत इम्प्रेसिव है कि इसमें हमने जो दिल्ली बेस्ड आयुष इंस्टीट्यूशन से उनको हमने इनवाइट किया, तो मोरारजी देसाई नेशनल इंस्टीट्यूट से 486 लोग आए इनोग्रल में, ऑल इंडिया इंस्टीट्यूट से 168 लोग आए, NCISM NCH से भी पार्टिसिपेशन हुआ, हेल्थ मिनिस्ट्री से भी आए और मिनिस्ट्री ऑफ आयुष के एंटायर पार्टिसिपेशन रहा. तो ये एक प्रकार से वेरी इम्प्रेसिव. मीडिया से भी 107 लोग आए इनोग्रल में. But other than that, the overall spectrum of Ayush, National Ayush Mission, I would like to explain कि हमें बताया गया है, हम सबको पता है, पिछले 2 दिन से चर्चा हो रही है कि कहाँ 75 करोड़ से शुरू किया था, कहाँ 1200 करोड़ पर पहुँच गए. पिछले बार 550 करोड़ रुपया खर्च हुआ था, 800 करोड़ मिला था, बट वी आर नॉट एबल टू स्पेंड मनी. रिवाइज एस्टिमेट में 800 का 650 हुआ. एंड हम लोगों ने खूब मेहनत करके कविता जी के लीडरशिप में नेशनल आयुष मिशन की टीम ने बहुत अच्छा स्टेट के साथ कोऑर्डिनेट किया, स्टेट का भी बहुत सहयोग मिला, तो 550 करोड़ तक हम पहुँचे. और लुकिंग एट दैट, बिकॉज आई वुड लाइक टू मेंशन, बिकॉज ऑफ द न्यू गाइडलाइंस ऑफ Department of Expenditure and lot of new things was happening last year. SNA, single nodal account, 75% एक्सपेंडिचर बुक होना चाहिए. 70 आपके SNA में 25% से ज़्यादा राशि होगी तो नहीं मिलेगी. UC 75%. Those are the, because those efforts were to bring in transparency and then the field level operationalization. तो वो तो काम के लिए ज़रूरी था, बट उसके कारण पहले दो ट्राइमेस्टर तक तो एक पैसा भी रिलीज नहीं हुआ था सर. 6 महीने तक तो वी वर नॉट एबल टू डू एनीथिंग, लेकिन बाकी 6 महीने में 550 करोड़ का अचीवमेंट हुआ. दैट इज वर्थ कॉम्प्लीमेंटिंग टू ऑल द टीम एंड ऑल्सो स्टेट्स, क्योंकि स्टेट्स के पार्टिसिपेशन के बिना नहीं होगा. एंड लुकिंग एट दैट, इस साल हम लोगों को बहुत चैलेंज मिला है, बिकॉज 550 करोड़ का उन्होंने 1200 करोड़ किया. When we had this discussion, budget discussion in expenditure, तो we were demanding 4,200 crore, उन्होंने 3,600 करोड़ दिए. बहुत बड़ी बात है. यूजुअली मिनिस्ट्री जितना मांगती है उसमें से 50% 60% मिलता है, सब नहीं मिलता. और हमें ये 4,000 मांगा 3,600 मिल गया, तो ऐसा बहुत कम होता है. एंड देन I would like to also mention that in 2014, the budget of entire then Department of Ayush was 691 crore. 700 करोड़ से भी कम था, जो 9 साल में 3600 करोड़ हुआ, तो 5 गुने से ज़्यादा हुआ है. So that is also, all these things are actually, cumulative. 21 out of 36 beneficiary states already have 75% expenditure this year. So it is becoming easier. Or also, in terms of availability and completion of basic amenities such as infrastructure, branding, establishment of herbal gardens, availability of essential medicines at all HWCs, which is already operational more than almost 7,500. 90% of states have completed this thing, 90%. So it is also very impressive. As a regular yoga classes, yoga instructor, necessary IT infrastructure, IEC, hoardings and signages, Prakriti Pariksha, availability of Pasha, is all these things are available in 80% of states in HWC. So all these statistics are very impressive. Also, मैं आप सबको निवेदन करना चाहता हूं कि 750 ऑपरेशनलाइज हुए, हमें 12,500 दिसंबर तक करने, आप सबको हाथ जोड़ के विनती करता हूं, उसमें जरा थोड़ा हेल्प कर दीजिएगा. Out of 135 approved integrated hospitals, Ayush hospitals, 106 have either been operationalized or under final phase of construction, expected to be operationalized soon. So that is also very impressive. 135 में से 106 जितने तो अभी इसी वर्ष में या beginning of coming year में हो जाएगा. Then also in education aspects, 113 institutions under NAME were supported and building 14 new institutions and total 654 Ayush grams were supported. ये सब चीज़ें जो है उसके साथ मैं बहुत कम समय में एक दो बहुत important बात करना चाहता हूँ. These are all impressive statistics which is highly encouraging, and it is because of the very good support from the states and participation and the active participation, leadership of Joint Secretary. I must compliment Kavita also कि आपने जिस तरीके से नेशनल आयुष मिशन को टर्न अराउंड किया, इट्स इम्प्रेसिव. एंड देन दिस 2 days ऑफ कॉन्क्लेव, राइट फ्रॉम डिजाइन एंड एवरीथिंग, मैंने इनको कहा था कि मैं आपकी फाइन डिटेल में नहीं जाऊंगा, इट इज़ योर टास्क, आप करिए उसको. मैंने जानबूझ करके थोड़ी दूरी बनाए रखी, एंड लुक एट द रिजल्ट, है ना, इतना अच्छा आपने जो काम करके दिया है. सो there are 2-3 things that I want to mention, like director from Chandigarh, मंजूश्री जी कुछ कह रही थी. मंजूश्री जी ने कहा कि हमें प्राइमरी हेल्थ केयर लेवल पर इतना मॉडल बढ़िया बनाना चाहिए कि सेकेंडरी टर्सरी केयर पर बर्डन कम हो. वंडरफुल थिंग, बहुत अच्छी बात है, लेकिन एक इसमें मिसिंग थिंग है जो हम सब लोगों को याद करनी चाहिए. जो आयुष सेक्टर में काम करने वाले लोग हैं उनके लिए विशेष रूप से याद रखते हैं. हमारे मंत्री जी भी कई बार कहते हैं इसको कि वी आर नॉट सपोज टू बी ओनली वेलनेस पीपल. We are not supposed to be just catering primary health care people. We are supposed to do everything. We are supposed to do secondary care. We are supposed to do tertiary care also, because everywhere there are some benchmarks. और सत्य कहीं किसी भी दिशा में जाए तो सत्य, अल्टीमेट सत्य में जाने के रास्ते बहुत होते हैं. किसी भी दिशा में जाए तो आगे आखिर सत्य में पहुंचते हैं. इसलिए प्लूरलिस्टिक हेल्थ केयर की विशेषता है कि होम्योपैथी हो, आयुर्वेद हो, यूनानी हो, सिद्धा हो, एलोपैथी हो, सोवा रिक्पा हो, नेचुरोपैथी योग हो, सभी के अपने अपने रास्ते, लेकिन इवेंचुअली वो सत्य की तरफ जाता है. तो हमें सबको आगे बढ़ावा देना है, और सब रास्ते सही है, सभी रास्ते अच्छे हैं, और जिनको जो समझ में आए वो करना चाहिए, लेकिन सत्य की ओर जाना चाहिए. बट विदाउट हैविंग दिस कंफ्यूजन इन माइंड दैट वी आर नॉट जस्ट वेलनेस पीपल, वी आर नॉट जस्ट ए प्राइमरी हेल्थ केयर पीपल, वी आर ऑल्सो एवरीवेयर. और इसलिए ये जो 12,500 हेल्थ एंड वेलनेस सेंटर की जो बात है, मैं आपको बताना चाहता हूँ उसकी हिस्ट्री, कि हमें चैलेंज मोड में मिला है. इस तरीके से मिला है, उसको कहा गया है कि आप प्रस्तापित करिए कि प्राइमरी हेल्थ केयर में आपका मॉडल आप बता सकते हैं कि हाँ हम इसको डिलीवर कर सकते हैं. दैट वाज द चैलेंज मोड. तो नाउ जो आपने 2 दिन में जो आपने जो सुना कि 8.5 करोड़ पेशेंट एक साल में देखे, विच इज़ नेवर हैपेंड. 8.5 करोड़ कितना बड़ा आंकड़ा होता है. इट इज़ ऑलमोस्ट 5% ऑफ और मोर देन 6%, मोर देन 6% ऑफ द टोटल पॉपुलेशन, जो आपने सिर्फ हेल्थ एंड वेलनेस सेंटर में एंट्री लेवल में छोटे छोटे सब सेंटर लेवल के क्षेत्र में आपने देखा है. इट इज़ अदर देन दैट देर आर सो मेनी अदर सिमिलर नंबर ऑफ पेशेंट्स विच इज बीइंग सीन इन सेकेंडरी टर्सरी केयर हॉस्पिटल्स. ये बहुत बड़ी बात है. इसको आपको ध्यान में आएगा कि अभी तक हम लोग छोटा छोटा काम करते थे, अब बड़ा काम करना शुरू किया, तो अब बड़ा सोचना शुरू करना चाहिए। दूसरा, अपने जो नेशनल आयुष मिशन के सिवाय जो भारत सरकार के आयुष मंत्रालय के जो इंस्टीट्यूशंस हैं, जिसके लीडर्स यहाँ बैठे हैं,
in 5 years. And then it is one of the best tertiary care hospital in entire आयुष सेक्टर।
आप एक देखिए वहाँ कभी जाके। तो मैं क्या कहना चाहता हूँ कि these types of benchmark models actually is showcasing how much is the strength, कैसे हम इसको इंटीग्रेटिव केयर में या कैसे, क्योंकि अभी वहाँ पर ये हाल है कि आपको मतलब इट इज़ इंटरेस्टिंग कि किसी को वहाँ एडमिशन चाहिए, वहाँ बेड नहीं मिलता, तो लोग मेरा झेक लगाते हैं, मुझे फ़ोन करते हैं, कह आप वहाँ बेड दिलवा दीजिए। दैट इज़ द काइंड ऑफ डिमांड। इसके साथ साथ एक लर्निंग मेरे लिए भी है। देखो, आज सुबह मैंने पूरा सेशन इसीलिए आया था, बेस्ट प्रैक्टिस के सेशन में मैंने पूरा पार्टिसिपेट किया। आई एम सो हैप्पी टू सी दिस डिफरेंट जननी प्रोग्राम, दृष्टि प्रोग्राम, नौका आयुष का जो सर्विसेज नौका में दे रहे हैं, या एक कैंप वाला जो उत्तराखंड का प्रयोग था, बहुत अच्छा था कि अपने CHO को उसी कैचमेंट एरिया में भेजा करो हफ्ते में एक बार। एंड आई हैव दिस पर्सनल एक्सपीरियंस कि इस प्रकार से आपके पास बहुत एंथुसियाज्म भी होता है, आपका कॉन्फिडेंस भी बढ़ता है और लोगों का पार्टिसिपेशन भी बढ़ता है। 2000 दी फील्ड लेवल एक्सपीरियंस जो हमें भी लर्निंग दे के गया। एक लर्निंग मेरे लिए भी है कि जब इसके बाद चाय का जब समय हुआ तो मुझे एक राज्य के, मतलब नाम ही लूँगा, एक स्टेट के डायरेक्टर ने मुझे कहा कि एक मैं बहुत अच्छा सुझाव आपको दूंगा। तो मैंने कहा बताइए। तो उन्होंने कहा कि जैसे मनसुख भाई मांडविया आए, सोनोवाल जी आए उद्घाटन में, दोनों ने इंटीग्रेशन की बात करी। फिर डॉक्टर मांडविया ने कहा कि हम महीने में एक बार मिलते हैं, आपस में चर्चा करते हैं और एक कैसे मिल करके एक स्वास्थ्य के लिए अच्छा काम कर सके उसके लिए प्रयत्न करते हैं। बोले स्टेट को क्यों नहीं आप कहते? उन्होंने मुझे कहा कि आपको स्टेट को कहना चाहिए। मैंने कहा स्टेट को हम कैसे डिक्टेट करें? बोले स्टेट वाले क्या करते हैं कि वो उस केंद्र की तरफ से कुछ आया तो उसको पालन करते हैं। तो मैंने कहा ये तो अच्छी बात है। तो दिस इज लर्निंग फॉर मी ऑल्सो दैट वी वुड लाइक टू राइट टू द स्टेट्स कि आप ये देखिए, हम लोग केंद्र सरकार के स्तर पर हम ऐसा काम करते हैं और आप स्टेट में भी चाहो तो एक बार जरा देख लीजिए। सो दैट कैन बी सजेस्टेड, दैट इज लर्निंग फॉर मी ऑल्सो। तो ऐसे बहुत सारे जो 2 दिन के काम हुए। एंड आई मस्ट अगेन reiterate the compliments and congratulations to the entire team and states for very active participation। इस प्रकार के मौके बहुत कम आते हैं और हम सब लोगों के लर्निंग के लिए काम में आते हैं। आप सब लोग जो आए हैं बहुत एक छोटा सा टाइनी पार्टिसिपेशन है व्हेन यू लुक एट द साइज। इसलिए मेरा आप सबसे निवेदन है कि इसको ज़रा डिसेमिनेट भी करिएगा कि आप अपने अपने स्टेट में जाएं तो अपने स्टेट के CHOs, अपनी टीम जो नहीं आए हैं उनके तक ये जो आपका जो टेक अवेज है उसको पहुंचाइए। इसके लिए मेरी रिक्वेस्ट टीम को ये रहेगी कि ये जो प्रेजेंटेशन है उसकी कॉपी, डिजिटल कॉपी सबको यदि हम दे देते हैं तो दे कैन प्रोबेबली यूज इट फर्दर फॉर द डिसेमिनेशन ऑफ दिस वेरी हाईली वैल्यूएबल नॉलेज। आप सबको नमस्कार।
चाहूँगी कि नेशनल आयुष मिशन ने नेशनल हेल्थ मिशन के साथ एक मेमोरेंडम ऑफ अंडरस्टैंडिंग ऑलरेडी साइन किया हुआ है। हम उसका कॉपी भी आपको प्रोवाइड कर देंगे ताकि स्टेट गवर्नमेंट में भी आप अपने अपने जो काउंटर NHM का है और नाम का है वो आप कर सकें। सेकेंड पॉइंट सर, विद रिस्पेक्ट टू डिजिटल डिपोजिटरी ऑफ ये सारे सेशन हम लोगों ने गूगल ड्राइव लिंक बना दिया, ऑलरेडी शेयर भी कर दिया और हम इसको नाम पोर्टल पे भी डाल देंगे। थैंक यू।
Thank you, sir. Thank you, ma'am. As we conclude this conclave, I invite Honorable Minister of State, Honorable Minister of State, Ministry of Ayush for the valedictory address.
Respected Secretary, Ayush Government of India, Vaidya Rajesh Koteja ji, both Joint Secretaries, esteemed officials of the states, duties officials of Ministry of Ayush, distinguished guests and other dignitaries present here. First of all, good evening and namaste to all of you. कुछ बात पहले मैं बता देना चाहता हूँ मेरा प्रवचन से पहले। राजेश जी ने बताया कि आप सिर्फ प्राइमरी केयर या वेलनेस, ऐसा कुछ नहीं, सब लोग कुछ भी कर सकते। अभी हमने गुजरात में हमारी भारतीय जनता पार्टी के अध्यक्ष जी के नेतृत्व में कार्डियो रिससिटेशन की ट्रेनिंग अपने सब बीजेपी वर्कर्स को दिया, सब नीचे लेवल के, कि सडन कार्डियक अरेस्ट हो जाता है तो वहाँ तो डॉक्टर तो होता नहीं, और ऐसी कोई प्राइमरी रिक्विजिशन है ही नहीं कि कार्डियोलॉजी वही कार्डियक रिससिटेशन करे, तो वो तो पॉसिबल नहीं है। तो छोटे से छोटा वर्कर हमारा है जो गांव तक का, उनको हमने कार्डियक रिससिटेशन की ट्रेनिंग दी, और वो भी ऐसे ही नहीं, पूरा हमारी एनएसएस सोसाइटी है उनके मेंबर्स को बुला के सब लोगों को दिया, और मॉड्यूल्स भी साथ में लाए थे। लेकिन ऐसा इंसिडेंस कहीं भी हो तो तुरंत कार्डियक मसाज है, रेस्पिरेशन कैसे मेंटेन करना है, जो एबीसी है ना अपना एयरवे ब्रीथिंग सर्कल, वो कैसे मेंटेन करें, और बाद में हमारे वहाँ 108 एम्बुलेंस है, वो सब हमने सिखाया। એટલે जो राजेश जी ने बताया वो बिल्कुल सही बताया। और वैसे ही आप देखो, ये गायनेकोलॉजिकल प्रैक्टिस, लेबर रूम, इंस्टीट्यूशनल डिलीवरी, वो तो बाद में, लेकिन पहले तो दाई गांव में करवाती थी, और अभी भी काफ़ी जगह जो दाई है वही नॉर्मल डिलीवरी करवा देती है। अगर कॉम्प्लिकेशन आता तो गायनेकोलॉजिस्ट पे भेजते। और ऐसे ही सरदार वल्लभ भाई पटेल का हमने सुना है कि उसको एक्जिला में बॉयल हो गया था, तो वो बार्बर को बुला के उसने बॉयल का एक्सीजन करवाया था। तो सब लोग ये प्रैक्टिस कर सकते, लेकिन अपनी लिमिटेशन मालूम होनी चाहिए कि हमें कहाँ तक जाना है, कहाँ तक हम कर सकते हैं। और इंटीग्रेशन के बारे में बताया कि स्टेट में, वो बिल्कुल आपकी सही बात है कि हम तो यहाँ कुछ करते, नीचे बाद में इन लोगों को मालूम नहीं पड़ता। लेकिन इंटीग्रेशन स्टेट नहीं, डिस्ट्रिक्ट और ब्लॉक लेवल तक जाना चाहिए कि हमारे जो आयुष के डॉक्टर है उसको कई जगह तो क्वेक बोलते थे, और काफ़ी लोग पैसे के चक्कर में उनके पास पहुंच जाते हैं कि आपके पास डिग्री नहीं है, आप डॉक्टर नहीं है, आप क्यों प्रैक्टिस करें। बायोमेडिकल वेस्ट वाले भी घुस जाते हैं। मैंने तो अपने जो वेल डेवलप्ड स्टेट गुजरात में भी ऐसे इंसिडेंट्स आते हैं कि एसओजी वाले भी चले जाते हैं। बाद में मुझे बोलना पड़ता है कि ये डॉक्टर है, आप उसको परेशान मत करो। और कभी एक बार तो ऐसा भी बोलना पड़ा है कि आपको उसको लेना है ना, तो पहले मेरी परमिशन लेगी और पहले एमबीबीएस डॉक्टर यहाँ डालो, बाद में उसको जो कुछ करना है। એટલે ऑलवेज सपोर्टिंग मैं आयुष डॉक्टर को करता हूँ। It has been an honor to be part of this delightful events of National Ayush Mission Conclave. Ministry of Ayush have organized this national conclave to discuss the achievements of the National Ayush Mission and help in addressing future challenges, way forward, comprehensive development, and to play an important role in keeping with new standards and new benchmark to proceed towards forging a self-reliant Ayush healthcare system. With the active participation of states UTs, it is expected to ensure better access to Ayush healthcare services through an enhanced number of healthcare facilities offering Ayush services and better availability of medicines and trained manpower, improvement in Ayush education through well-equipped and added number of Ayush educational institutions to focus on reducing communicable, non-communicable disease through targeted new public health program using the strength of Ayush system of medicine. I am very happy, much confident that deliberation made during conference has provided an opportunity to the ministry as well as state UT to jointly review the mission, examine effective policies, building governance frameworks, its implementation and strategies, revive gaps, innovative ideas, better decision making, streamlining the financial flow to enable the state UTs for expeditious implementation of program at the grassroots level. As per roundtable discussion held along with Honorable Minister and officials of the state UTs as well as officials of the ministry, I would like to request state UT that they have to focus on following point for effective implementation of the NAM scheme so that better outcome may be obtained. Number 1, timely submission of the state annual action plans. Second, effective utilization of the previous year's release grants and timely submission of the utilization certificates to the ministry. Third one, appropriate strategy and roadmap has to be developed for time-bound completion of the infrastructure project. Fourth, effective measures have to be taken for operationalization of the approved Ayush Health and Wellness Center at the earliest. Appropriate measures are required to be taken for compliance of different conditionality of the issue guideline of the Department of Expenditure so that after approval of state annual action plans immediately grant may be released. As you know, our Honorable Prime Minister Narendra Bhai Modi ji took the novel initiative at the United Nations General Assembly to celebrate the International Day of Yoga on June 21st every year for the past 8 years. The states UT have been supporting Ministry of Ayush for successful observation of IDYs in the past. Therefore, I would like to again request all the states UTs for their active support so that yoga may be observed at all Ayush Health and Wellness Centers and Health and Wellness Centers of the Ministry of Health and Family Welfare and all facilities supported by National Ayush Mission, Educational Institute, Hospital, etc. and make it a huge success. I hope this national conclave as hosted by Ministry of Ayush will build strong foundation for further development. I take this opportunity to convey my heartfelt thanks to the Honorable Ministers and officials of the state UT who have spent their valuable time for grand success of this 2 days National Ayush Mission Conclave. Thank you. Jai Hind. एंड बाद में फीडबैक भी देना है, ये कॉन्क्लेव आपको कैसे लगा। इसमें सबसे अच्छा लेक्चर प्रेजेंटेशन किसका लगा, कहाँ हमें इम्प्रूवमेंट करने की ज़रूरत है, क्योंकि हम भी आपके पास कुछ सीख सकते हैं, क्योंकि ये 1 वे नहीं है, 2 वे है। और नेक्स्ट कॉन्क्लेव हमारा कहाँ हो उसके लिए भी ज़रा बताइए, तो उसके बारे में भी मैं और सोनवाल और सेक्रेटरी साहब हम तीनों सोचेंगे, ऐसी मेरी रिक्वेस्ट है। थैंक यू। जय हिंद।
मिनिस्ट्री ऑफ आयुष के बिहाफ पर हम सब आपको धन्यवाद देते हैं। स्पेशल धन्यवाद मेरे स्टेट गवर्नमेंट एंड यूटी से आए हुए लोगों को, नेशनल आयुष मिशन के सेंट्रल प्रोजेक्ट मैनेजमेंट यूनिट को एंड सभी को जिनका मैं यहाँ पे नाम ले नहीं पा रही हूँ, बट मेरे हृदय में उनके लिए आभार है। हम ऑनरेबल मंत्री जी से रिक्वेस्ट करेंगे कि एक फ़ोटो अपॉर्चुनिटी के लिए सर प्लेनरी हॉल में चलें, यहाँ पर थोड़ा स्पेस कम है। आप सबसे मेरा रिक्वेस्ट है कि प्लेनरी हॉल में हम क्विकली एक बार इकट्ठे हो जाएं, एक फ़ोटो अपॉर्चुनिटी विद ऑनरेबल मिनिस्टर। थैंक यू ऑल।